So our next speaker is going to be from Malawi, and the presentation is nicotine-containing products brought in and around the hospitals, developing an understanding of the retail environment.
Hi everyone, I'm Tabitha Msukunika from St. John of God, Malawi, Lilongwe Service. I will present to you this morning on nicotine-containing products bought in and around hospital, developing an understanding of the retail environment, a study that was conducted in 2019 at King's College Hospital and Maudsley Hospital. The National Institute for Health and Care Excellence in UK recommends the sale of licensed nicotine-containing products, that's nicotine replacement therapy, in hospital shops. NRTs such as transdermal patches, chewing gum, nasal spray, inhalers, tablets, and lozenges have been evaluated as smoking cessation aid that increase quitting by 50 to 60%. This there is also strong evidence from Cochrane review that shows that use of NRTs tend to increase quit rates among smokers. However, other unlicensed nicotine-containing products such as electronic cigarettes are also effective in assisting smokers quit. And this is according to a randomized controlled trial studied by Hajek in 2019. And also at the same time, the Public Health England have recommended the use of electronic cigarettes as to be more effective in helping smokers quit and also 95% less harmful. So even to date, the implementation of this nice recommendation has not been evaluated. So the study aimed to investigate the availability of nicotine-containing products sold in hospital shops, pharmacies, and the retail environment in the immediate vicinity of 500-meter radius of King's College Hospital and Maudsley Hospital. So this was a quantitative study and it was observational study. Our population was all hospital shops, pharmacies, and shops that were located within 500 meters of hospital sites. The participants in the study were chosen using convenient sampling. The area was identified using Google Map. So we excluded cafe shops and also other shops not selling nicotine-containing products, as well as those shops that were not located within the identified distance. A questionnaire was developed to audit the shop. So the questionnaire was developed based on other studies that also looked at nicotine-containing products that are bought in and around hospital. So we also seek ethical approval from King's College London Human Research Ethics, and data was collected by 3 researchers. The process of data collection involved making observation in those shops for the following measures, like type of shops, availability, advertisement, as well as also promotion of nicotine-containing products. So data was analyzed using SPSS 25th version, and where descriptive statistics was done to generate percentages of identified measures. So as you can see, these are the results, and that is the map for where the study was conducted. A total of 16 shops were audited, and out of those, 6 were hospital shops, 2 pharmacies, 7 convenience or grocery shops, and 1 specialized baby shop. On nicotine-containing products availability, we found that in all hospital shops, there was no sale of NRTs. There was only sale of electronic device, that's the first generation device. And in hospital pharmacies, we found that they were only selling NRTs based on prescription, but also community pharmacy, they were selling e-liquids. In convenience grocery shops, we found that only 1 shop was selling NRTs, The 7 shops were all selling electronic devices as well as the e-liquids. And also we found that all the shops were selling combustible tobacco. In specialized vape shop, we found that they were selling electronic cigarettes as well as e-liquids. In all the shops, we found that there was no sale of smokeless tobacco. On advertisement and promotion of products, that's the one of the signposts advertising the sale of first generation electronic cigarette outside the hospital shops. So when we look at the advertising and promotion of nicotine-containing products, it was noted that NRTs were not advertised as well as promoted in all the shops that we audited. But when we look at the hospital shops, we found that one hospital shop was advertising the sale of this electronic cigarette both inside and outside. There was no any promotion of or sale of electronic cigarette. And in pharmacies, there was no any advertisement as well as promotion. But then convenience shops, we found that outside the shops, 3 shops were advertising sale of electronic cigarette, and also I quit ordinary smoking in one of the shop. And inside the shop, we found that there was advertising of electronic cigarette in all the shops by textual listing. And also we found that one shop was advertising tobacco at point of sale. And 5 shops were advertising rolled tobacco inside the shops. And on promotion in the convenience or grocery shops, we found that only one shop was promoting the sale of electronic cigarette. That's buy one get one free, and the type of the cigarette was Broom. But on specialized vape shop, we found that there was no advertisement of the electronic cigarette outside the shop. They were only advertised inside shop. And also there were some rewards that in form of rewards card that were given to customers who purchase electronic cigarettes. So basically, with the findings, contrary to NICE recommendation, we found that NRTs were not available in hospital shops. Despite that, NRTs were sold in the hospital pharmacy and one convenience shop, their availability was relatively low as to compare with other nicotine-containing products. Electronic cigarettes and tobacco cigarettes were available in majority of retail outlets within 500-meter radius from the hospital shop sites. So overall, there is low availability of NRTs than electronic cigarettes, of which is suggestive of reduced demand for the product. So when we looked at our results with the available literature, we found that there was no any publication. We found that we could compare our result on with the nicotine-containing product and hospital shops. So we only found results that that were similar to our study on nicotine replacement therapies that were available over the counter from community farmers, were similar with the study that was done by Benster in 2009. And our findings also were inconsistent regarding to e-liquids with the study of Wenger study in 2014 that reported sale of electronic cigarette device only. But our study only found that electronic devices were sold in conjunction with the e-liquids. So results from the retail environment also support findings from studies that characterize electronic cigarettes and tobacco retail outlets by Hammond study in 2015, Patterson study in 2018, and Baker study in 2018. So the implication of the findings is that there is need to introduce the sale of NRTs and electronic cigarettes in hospital shops to increase their availability and also to help smokers quit smoking and to deliver nicotine in a safer way. And also at the same time, there's need to monitor trading standards by the advertisement that are being displayed in the shop. Since we found that one of the shop was advertising the sale of tobacco at point of sale, which is not in accordance to the tobacco regulations. And further, we recommend that a large study should be conducted to investigate the availability of nicotine-containing products in hospital shops and its retail environment in England in order to generalize the results. In conclusion, the study investigated availability of licensed and unlicensed nicotine-containing products in hospital shops, pharmacy, and retail environment of hospital sites. So overall, our observation of these retail outlets has shown that licensed nicotine-containing products are not available in all hospital shops. Although they were available, they were sold in pharmacies and convenient grocery shops, their availability was low as compared to other unlicensed nicotine-containing products such as e-cigarettes and cigarettes.